Thank you very much, Chair, and I want to welcome all our guests today to the Honourable Sarah Jane, Angela and Aine. You're very welcome today. To Sarah Jane, from a fellow Kildare person, you're particularly welcome from the great county of Kildare today. And Sarah Jane, just to start, I suppose, with yourself, I totally agree that independent living doesn't start at 55, and that is very important. And I know that has been an issue that you raised today, and maybe you might just make a comment on that, because in fairness to when I deal with a lot of people who want independent living, the first barrier that's put up to them is that the age of 55, which is wrong, and it needs to be addressed in housing strategies, and something maybe that we can deal with again. Just also to be associated with Pauline's words in relation to the great work that Inclusion Ireland do, and to thank you for the work that you do on behalf of so many. I suppose a couple of questions, and just talking through your presentation. Public information accessibility, just in relation to government information, just in relation to information in the Oireachtas, maybe Derval, you can come back to us on how accessible it is for people and what we need to do different. I know previous contributors to the committee have spoken about this, but just to get your comments from an Inclusion Ireland point of view as to how accessible or not it is, and I think that's very important for us as a committee to hear that evidence from yourselves on a day-to-day lived experience, because it has to be accessible, it needs to be changed, and just obviously to get a comment on that. Just in relation to, again, agreeing with what Pauline said, education is key to this, and you've said that yourselves in your contributions. I've spent the last week dealing with a person who has a 4-year-old non-verbal child who has only, at this stage, Derval, contacted 8 schools in their area, but they're dealing with the current school they have, the current primary school, who are very good for them, and they've been very fair to the family, and their siblings are actually in that primary school. But that particular primary school has informed the parents that they can't cater for the future needs of that particular child. And they've already, the father came to me at a clinic on Monday night, and he was in a desperate state. They rang 8 schools in the Kildare area and in a border county, and this just can't get anywhere. And that's unfortunately symptomatic of a number of conversations I've had with parents, and I know of speaking to members of this committee with other parents as well. And it goes back to the issue that contributors have spoken about before, and that's, you've mentioned it again this morning, planning. The gathering of information, the gathering of data, and maybe to get a comment from yourselves in relation to what we're doing wrong, not doing, in relation to the gathering of such data, because to me it's again key and cornerstone to how we actually develop policy around where we should go in relation to autistic people, and that's most important. You know, that if we're to plan for schools and special schools, if they are needed, then we need to gather that data, and there seems to be a lack of joined up thinking in relation to that. So just maybe to get a comment in that. Going back to independent living, I'm dealing with a number of people who are independent living, and I see the advantages of their daily lives, what it means to them, and maybe I'm hit again by the 80% unemployment rates among adults. Maybe to get a contribution from yourself for that today. It was mentioned here before. I think the last contribution I thought I had in my head was 60%, and if it's gone up to 80, that's even more worrying than we have. And you know, we all need to do more in relation to helping people get employment, but that's a pretty worrying statistic if we have 80% at this stage. And of course, going back to the cost of living with a disability, and Anya, just I have to say that both yourself and Inclusion Ireland, the fact that you're not on the National Inclusion Strategy is mind-blowing, and I think, Chair, something that we need to pick up as a committee. You know, your credentials go before you, Anya, and what you presented to us today, and you know, that's what we should be listening to. We should be listening to the cost of disability. And just again, what Pauline has said, and just taking up one other point, that there are families there with an average debt of €3,260 a year, after, with the cost of taking care of their loved ones. How is that broken down? Is it the cost of keeping light and heat? I know there's a cost of living crisis, but can you give us more of what that's in that depth? I know you've fleshed out a little bit of it, but this is what we get, Chair, and we've had this from families coming in previously, that it's a huge issue for families, you know, the cost of caring for their loved one. And, you know, maybe just to flesh out that again, Anya, from your expertise that you have. And, you know, again, just to say I can't believe that, but just, Chair, maybe to leave it at that at the moment. And if they could get some answers to those questions. Thank you, Chair. Thanks
very much, Senator Wall. Maybe we'll take Anya, we might take Dr. Roddy first this time.
Okay, thanks for your questions, Mark. So firstly, the unemployment rate is at 80% for autistic adults. It's extremely frustrating because so many autistic adults would express a huge desire to be in employment. It gives great meaning and dignity to their lives, and they want to be in employment. It's just that there's different barriers there in accessibility, in being involved in employment. There have been a few studies that have looked at, say, the cost effectiveness of programs to try and say that there be more of a support program in place, maybe to help, with the interview process, being involved in employment where people might say advocate for their needs, or, that the employment setting is appropriate. And there is some evidence, there certainly to say that this is an effective way to go about it. Autistic people have so many talents to offer. This is where it's so frustrating. Like, they have such potential if they're just given the appropriate supports and opportunities. So there are kind of different specialised organisations that work with As I Am in trying to increase employment rates in Ireland, but there's so much more needed to be done, and it needs to be done at a much earlier stage than when they hit 18 or in their 20s. It's those key progression stages from primary school to secondary school, finishing secondary school, third level. It's at a much earlier stage that this needs to be happening to get the programmes in places. So it is at the 80%. In relation to the debt, my concern is that parents were expressing a lot of the debt was in relation to paying for private services and supports, which can be very unregulated in the types of services that they're going for. So with the best intentions in the world, they're paying for certain things, but there may not be the evidence base there to actually back up what they're paying for. So that's of huge concern, that there's overall a lack of information and supports for parents when their child is diagnosed with autism or at a later stage, and they're paying privately for different. Some might be great and they find it helpful for the child, but others may be questionable in approaches. It's with the best intentions they're doing it, but it seems to be more in that direction of it's the private services they're paying for rather than maybe, say, extra living costs. That was what they were focusing on. So they might decide we'll go all out, we'll go for a special intervention, and the therapist might say, well, this will be at least a year, and they're going into that debt for it. So that was what they were reporting in relation to the debt.
Can I just make a point as well, as one of those families? My son would have high support needs. A lot of the costs are hidden costs that you wouldn't actually think of. Like, my son might go for 2 months at a time where he'll only sleep for 2 hours a night. So we're up as a family for like 22 hours. We're using electricity, we're eating, we're watching the TV, we've got the lights on. He also has loads of little extra kind of gadgets because he wouldn't play with toys or anything like that. He wouldn't get the concept of it, really. So a lot of the time, we've got lights on, we've got things that make noises and buzz and whir and things like that. My electricity bill is so much higher than any of my friends. Then my son would have continence issues. So his continence pads weigh a ton. He's 15, so, things are heavier than a baby. You're not talking about baby's diapers here. So my bin costs, because it goes by weight, are through the roof. There are things like that often people don't actually write onto surveys, because often you get asked about things like private therapies, which, don't get me wrong, they do cost a lot. That's a very valid point. But you have to think about the hidden costs as well. And when my son was born, because there was such a lack of access to services at the time, me and a few other parents started our own organisation so that we could start providing services ourselves. And we worked every hour God sent for many years to build it up so that we would get to a position where we felt like people would be scared not to offer us what we deserved. That if we came knocking on your door to ask about your services, we wanted to know that you were hiding behind the couch. And that was what we did on purpose. You shouldn't have to do that. You shouldn't have to. I went and got a master's degree in disability studies so that I could better support my child. I shouldn't have to do that. Do you know, we have to do all these extra things. So often the things that people struggle with and the fight that we have is the unseen fight. And it's also a thing I keep banging on about to Derval as well, is the cumulative effect of having to advocate and constantly having to give out about money or constantly having to fight. Over the years, you get so fatigued and so beaten down by that and constantly feeling like schools don't want your child. Services aren't there for your child. Nobody wants your child. that over the years of that continuous chip away at you has a real toll on people's mental health. So,
Thank you.
sorry, just wanted to add that.
Yeah, thank you.
Sometimes people, when they look at the research, they don't get to see the families, they just get to see the numbers.
Yeah, thank you.
Thank you. And Dervla, do you want to come in? Or Sarah?
Maybe if you want to come in about housing and your experience around housing, because Senator Mark Rowell asked you a question about that.
Well, housing definitely needs, because when we went about a year ago, my mother rang up the local TD to ask about me on the housing list. They said, right, I was on it, but they'd offered me a place in Naas. They said, though, I have places in Naas, but she has to be over 65 to avail of them. But hang on a minute, there's places in Selvers that she could be over 55. But if she has to be over 55 to avail of one of them. So Mum just says, what could you say? You know, because she says she does not want to go into residential care, because that was what the alternative was.
Very good.
You know, so as we said, right, we just have to wait and see what happens. But I haven't even seen the outside of these houses. So I'm trying to figure out whereabouts in Shelbridge are they, because if I could even look at the outside to see what they look like, because if they have to put £2,000 worth of money into them, then then they're no good.
Of course.
You know what I mean? Like, these could be old houses that, you know, or they could be modern houses, we don't know.
And your experience, because Senator Wall also asked about accessible information, Sarah Jane, and you were talking about how challenging it is to apply for social housing in the first place.
It is actually very, very challenging. You know, like, I mean, I asked my service about 5 years ago about when we decided to sell the house in Eaststep, about the housing list. Now, they filled out the forms with me, but there was no record of that. When we went and asked 3 years ago, there was no record of that. So we had to do it all over again. You know, so...
The application process for housing is just horrendous.
It is.
Yeah, one of my tasks last year was to do research into housing and also to look at, you know, the practical things that we could do to support people. And the number one thing that people were saying was the application process is an absolute nightmare, and I couldn't actually believe it myself when I looked at the application form, and I think it was like over 25 pages long. And if you have an intellectual disability, approaching a form like that and getting all the documents together is just ridiculous. That's a really ableist system that puts real barriers there to people getting access to housing. And a lot of people didn't even know that they were supposed to go on the housing list or that they could go on the housing list. There just seemed to be such a lack of information there for people. And even though if you looked for it, you'd find it on different government websites, again, for some people, that's just not an option. They need information to be more accessible to that.
I'm really glad you brought up about accessible information. It's a core pillar of our work at Inclusion Ireland, and you've probably seen we've moved even beyond, you know, creating easy to read documents and much more into video and accessible information in multiple ways. And I think there's a lot of myths about accessible information as well, that you just put some pictures on a document and there you go, it's done. But really, accessible information is about a total rethink about how we communicate with one another respectfully, openly. Giving people information is about giving people power, and ultimately it's one of the biggest barriers that autistic people and people with intellectual disabilities face is the lack of accessible information, the lack of accessible processes like applying for housing. So we need to look at it in a kind of really layered way, that accessible communication and information is also a human right, and it's the bit that gets you the seat at the table. And if that's not there to begin with, that barrier has just removed you from housing. It's removed you from so many aspects of civil life. So I think it's a really important point. And we're creating our new strategy at the moment at Inclusion Ireland, and a key pillar of that will be around inclusive communication and supporting government and state agencies to become more inclusive in how we communicate. And I'm not saying we have it perfect at Inclusion Ireland. We are constantly learning from people with intellectual disabilities who give me really open and valuable feedback every day when I mess up. You know, it's we don't have it right all the time, but I suppose it's about a process and a journey around inclusive communication, and it takes time and a willingness to listen and to mess up and to figure it out. But I suppose we will be supporting state agencies to develop communication systems. And thanks for bringing up about housing. And Sarah Jane has explained, obviously, her direct experience in the barriers that she's experiencing. And housing at Inclusion Ireland, again, is another core pillar of our work. You know, I mentioned in the opening statement that we still have 2,400 people living in institutional settings. There are 1,300 disabled people living in nursing homes who are under the age of 65. And the thousands of people who are living at home with their families who've never had an opportunity of having your own front door key. And just in terms of solutions around that, I suppose the government themselves have published the Disability Capacity Review highlighting all of these issues. And, you know, we are calling for the implementation plan of that to be published. We're still awaiting that implementation plan. Our understanding when disability moves to the new department officially, that implementation plan will be looked at and prioritised, because really the only way out of this is planning. And Pauline, earlier you mentioned about that crisis piece. You know, at the moment in the system, you know, we're waiting for a crisis to happen. So an elderly carer passes away and then an emergency plan has to be put in place for somebody, which is totally non-human rights compliant. It, in the most distressing of times, to have to go through that for something that's entirely predictable. Like, we know that there needs to be X amount of additional housing every year for people with disabilities. And what ends up happening in emergency situations is that we end up going for a more institutional model, or something that's put together quickly, that doesn't involve the choice and control of the disabled person. They don't have a choice about where they're going to live, who you're going to live with, and that's the hallmark of institutional living. And that just needs to end, and the only way out of that is a comprehensive plan and the publication of the implementation plan for the Disability Capacity Review. So thank you.
Thanks very much. Thanks very much, Senator Wall. And next we have